Good evening. I'd like to call to order the Caldwell County Department of Social Services Board meeting. Today is Tuesday, September 28th. We're 5 o'clock, a little after 5 o'clock. We had some technical difficulties, and we're in the Alden East Starnes building here in the county complex. I'd like to start out by, we'll ask our director, Mr. Will Wakefield, to lead us in the Pledge of Allegiance, and we'll follow that with the invocation by Dr. Chuck Brawley from College Avenue Baptist Church.
Stand and face the flag, please. I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Mr. Brawley?
Would you pray with me? Dear Father in heaven, we thank you for the opportunity to serve our community. I thank you for these people who have been willing to give their talents, their skills, their time, and their resources to this calling. Lord, I pray that they will have wisdom in their meeting, that they will have patience, for truly the people they serve are sometimes a stubborn bunch. And we are often impatient when things have to move a little slower than we like. So Lord, bless them and help them to know that our community appreciates them and prays for them as they carry out this important task. In your name we pray. Amen.
Amen. Thank you, Mr. Brawley. Appreciate you. It's always good to see you, my friend. You've been doing well?
Appreciate you.
Thank you. You've been doing well?
Very good, very good. I'm heading down to Sam's to buy some stuff for the high riding football team on Feeding Friday.
Awesome. Thank you, sir. Thank you for all you do.
Blessed day.
Thank you. All right. Next on our agenda is going to be the any amendments from the Board of Director. Nope, no amendments. No amendments on the agenda. So need a motion to approve the agenda.
I'll make a motion to approve the agenda.
Second.
Have a motion and a second to approve the agenda. If all in favor, please say aye.
Aye.
All opposed. Now I need a motion to approve the minutes from the last meeting.
I move that they be approved as written.
I'll second.
Have a motion and a second. All in favor, please say aye.
Aye.
Aye. All opposed. All right, moving into the meat of this meeting. Next up is going to be the reports, funding updates. Mr. Will Wakefield, Director, and Kim Arnett, Children's Services Program Administrator.
All right, what we wanted to do, over the past couple of meetings, and I think last meeting we talked some, but over the past couple of meetings, we've talked about some different areas of funding, and we were waiting on some funding and potentially receiving some funding, and so we wanted to talk a little bit about that to help you understand what kind of where we are with that funding and what that means to our community and to some of the folks that we serve. So the first area of funding is around food nutrition services. And I believe it was last meeting I had talked about where the state had some additional funds to assist counties with the administrative cost of food nutrition services. And basically that means funding that assists us. The county pays 50%, and then the state, really the federal government, pays the other 50% for the work that we do, not necessarily the food nutrition funds that help people purchase their food, but for us actually providing the service of eligibility and those types of things for food nutrition. So they had some additional funds, and they thankfully asked some of us, our Directors Association, to help figure out what they could do with those funds. And so we had a couple of meetings with them, and we asked if they could figure out a way to get those funds back to the county for the services that we've already rendered. They had to spend those funds by September 30th because those funds were coming from additional funds around COVID money, American Recovery Act money. So they agreed with that to basically give some funds back to the counties for money that they had already spent within the past year. So we have received $54,000, and we should be receiving another installment of $54,000 for a total of $108,000. So that means that we will be receiving some additional revenue that we had not budgeted for. We didn't know this was coming. And so that will come back to social services, come back to the county, and so that will be good for us in terms of, for anything that we may have some additional needs. But that's hopefully should end up being $108,000 that we had not budgeted for that. So typically that does not occur. That's not something that we get very often. So we are glad about that, and I wanted to kind of let you know about that. We have received the $54,000. We believe we should be receiving another $54,000 in that area. So that will be good. That will be important for us. The water assistance. This is another area where the American Recovery Act through the American Recovery Act, funds have been passed down to the state, to counties, to municipalities for a lot of different things. And so some of that money has been given to the state to assist people with paying some of their water bills. I've been a part of a work group where we have been talking about how is that going to occur. There are over, I believe it was 500 different water providers across the state. And it gets a little complicated because all of those water providers, many of them may belong to a county system, they may belong to a city system, but there are some that are out there that are kind of private in different ways and aren't necessarily a part of county or city systems. And there is there's no really overall connection necessarily or communication between all of those 500 different water providers. So each of those providers can do it in a different way. So our task has been to figure out how, working with Department of Social Services, how can we communicate with those water providers so that we can exchange some information, find out who has the need, talking to those water providers, who are those families, those individuals who are either already may have a cutoff notice for their water, they're getting ready to be cut off, or they could be in danger sometime in the near future, and to use those funds to assist those people. So we have been meeting over the past really month or so, and we still have some work to do to figure out the best and most efficient way to do that. It's basically cooperation between the state, your county Department of Social Services, and then all of those water departments. So we are in the middle of doing that. We look to have that work completed, and hopefully somewhere around November, and we're hoping at latest December, we're going to be able to have those communications and be able to figure out who needs that assistance the most and get that to people in our community. That's just another way that we can assist folks with maybe some areas where they've struggled over the past year and a half through those American Recovery Act funds. We've been in contact with our different local water providers within the county to make sure that we have a good relationship with them, because we talk with them anyway, and we assist people at different times with them. Water is not a typical funding stream that we have, so when we do assist people historically with water, we really don't have that much funding for that. So, and this will just be a one-time thing. This is not going to be an every year thing, we don't believe. But we hope that will be helpful within our community, and we look forward to getting that up and running and working that out with the state. But it has been a little bit more complicated than what we had thought it was going to be. It's kind of one of those things where the feds, they send this information, they say, oh, well, all you have to do, state and counties, is, just do X, Y, and Z, and, pretty simple process, send us your plan. Well, we work together with the state sends in their plan, and then they come back with a whole host of questions around, oh, well, you didn't do this, you didn't do that, this, that, and the other, and it's like, well, we were never asked about those kinds of things. So there has been some back and forth with our federal partners, but that is getting worked out, and so we look forward to that program, hopefully bringing some assistance to some of the families and individuals that we serve who have been having certainly struggles here in the past year and a half. The Lynx funding, Lynx, yeah, come on up. Come on up. Lynx is a program that helps to transition children in foster care to adulthood. And it is specifically for children from age 14 to 21. And we use Lynx money in a lot of different ways to assist those children, to help them, to help teach them skills, to help them to learn how to become independent. If we know there's a child that potentially is going to age out of foster care without finding permanence, then we want to help to teach them how to become, how to make that transition into adulthood, how to become an adult who is able to, or a young person who is able to kind of get out there and have some idea of what they're supposed to do. Because I think, as we all know, if you have children, just because they turn 18 doesn't necessarily mean they understand what's going on. Even though they may tell you
Well, they think they do.
they think they do.
Yeah.
They have that understanding. So we've got a couple of different pots of money that we have been given. And one of those pots of money is actually, it's there to serve children who have been in foster care, but now are between the ages of 18 and 26, up to 26.
Yeah, so I'll just say, the child had to have been in custody at age 14, but could have left custody by way of adoption, guardianship, custody, whatever, before they reached 18. And so the rule or the eligibility criteria now is had to be in custody at age 14, and now they are 18 to 26. So that's the eligibility criteria. So as of September 30th, 18 to 26 is the group that this funding is aimed
So you start out
Aimed
at
at.
14,
You can start receiving Lynx services at 14.
right? But now you got to be,
But
for
for
this
this
pot of money, you got to
particular
be 18,
stimulus is
26.
what, yeah, for this
Got it.
particular stimulus funding, they have to be now 18 to 26.
Got it.
So,
It's been a little complicated, and it was
Yeah.
thrown on us about 3 weeks
Oh,
ago.
it was very sudden.
Yep.
And unfortunately, it's one of those situations where if we had been asked, say we as counties, if we had been asked, what's the best way to do this, we would have given a much different response and have since helped them to understand what what would have been the best way. And so it's been a lot of work on Kim and some of her staff to try to contact as many of these young adults as we can to take.
That's what I was getting ready to ask you.
know,
How do you track them
Yeah.
back down after they're
And
gone
that's
out of the
not been
system?
easy.
It's not been easy, so just being able to figure out how to run a report to find out who they are was difficult. But I will say we have several people in our permanency unit. Supervisor Tanya Machia has been the biggest asset in this whole process. She is our 18 to 21 social worker and Lynx coordinator, and she has just worked diligently, and she's recruited some help from other permanency social workers, our visitation coordinator, supervisor, to go through and look at these reports, track down each individual case, and make sure that child was in custody at age 14.
Wow.
And then try to track down where they are now. And so we ended up being able to track down 104 youth.
Oh, wow.
Yes, and so
A huge number.
it is a huge number. And I will say, the allocation that we received was 4 times our normal yearly Lynx allocation, which was about $104,000 is what we received.
That's correct.
And so we are currently a few $100,000 over that allocation.
Yeah.
So about 322,000
I think
over.
counties, and certainly our county, were able to locate many more young adults than what there's
Expected.
money available. So we're waiting on some guidance from the state, because we will easily eclipse that 104,000.
So you think they're going to send you some more?
If it's available,
There is a
Yeah.
possibility.
Yeah.
It depends on how the other counties do. I don't think there's going to be any way that we will probably be able to help all of the ones that we have found. But if they send that money to us, then we will
Yeah.
certainly be able to do
Well, the
that.
good news is you know where they are.
true. And, maybe the state will have some flexibility in the amounts that they've allocated. I don't know, but I know we as a county can't change that.
Right.
So we have to wait for guidance and then figure out how to allocate the funds we have, and that's going to be a hard thing to do, because which youth get these funds.
Right. Yeah, how to prioritize that.
Yeah.
But for a group, an age group of young adults who typically, and we know this historically, studies will show for those that do age out of foster care, they struggle in a lot of different ways. And I think we can all understand that and imagine that. But for those that we can assist, this will kind of be like a stimulus in a sense.
Yeah.
Most of those young adults did not receive any type of stimulus money or what have you. So we do look forward to being able to help the ones that we can assist. And so that's going to be a positive. Even, if we can't assist all of them, it'll be a positive anyway that we can try to assist the ones that we
And
can.
Quick question about
Sure.
that. So do you just say, here's the money? Or do you say, we'll put this towards your schooling, or so they just give?
Yeah,
them-
because they're adults, and so we have to, because we've talked about that, because some of the young adults that we know have certain needs, and we know that it would be best if that money was spent in this particular way. However, because they're adults and because this money is, somewhat of a stimulus, we have no control over what they do with that money,
Yeah.
so.
Now, some of our other Lynx money that we have, it does fall under specific areas
does.
and guidelines that we use to assist them. And so in kind of the normal, what we call the normal Lynx money, we are able to help guide where
We
that-
have, yeah, and we
those
have
resources
we have to approve
Yeah.
of what that normal yearly allocation is spent on, but not this particular pot of money. So,
So is there enough money to help all of the ones that you found, or will it be you don't know
As
yet
of
how to
now-
prioritize it?
As of now, the allocation we have is 104,000.
Right.
We have an estimated total needed at around 400 and some thousand
So
to
we're about
serve
300
all of
some
the
thousand
youth
short.
we've
Okay.
identified. So,
Short.
Yeah.
but
Oops.
we've had numerous in the beginning of this process, we had really no guidance, and
Well, my guess
then-
is the state probably didn't have any idea how many
Right.
kids were out there. They just, here's a pot of money,
don't-
we're gonna send you $100,000 and this is what you're gonna do.
I think
with
they
it.
had no idea how many we could
Fine,
find.
that's what I mean, that's what
And,
I'm saying.
yeah, and so, now, there are some counties that may not spend their entire allocation. So that money will go back into the pot, I guess, and then be distributed to those counties who are over their allocation. But being on the call I was on last week, there are more counties over than under. So, I don't know how they're
How are
gonna
we gonna
handle that.
determine which kid gets it, which kid don't get it?
That's a good question. And that's gonna
And
be
you
a
figured
hard
that one out yet,
decision.
have you?
Yeah, that's gonna be a hard decision.
Understand?
Because we, as the county, a lot of these youth, adults, young adults, we haven't had contact with, so we don't know what their situation is. So it can't be needs-based because we don't know what their particular needs are right now.
Yeah.
And so, we're hoping for some guidance from the state around that.
Yeah, it was a process that was unfortunately not well planned and thought out. Understanding that it's tied to some funds that had to be, they had to be obligated by September 30th. So there was some,
Little rush.
But again,
Yep.
Very rushed.
Got it.
we would have liked to have been involved in that a little bit sooner.
So we have 2 more days, and so we're likely to be even further over in the next 2 days. So we'll see.
We will mention, there's one other, a little bit of Lynx money that we also received an allotment for, to assist with some supplies and some potential needs for staff as well as some of the young adults. And I know Kim has been working on some of those.
Yeah, that was the CARES Act, the 4B, it's got 4B funding, and so we had a certain amount of money, I think, $14,000, that we could spend in certain ways. And so one of the ways was telecommunication because of COVID and telework and different things. And so that was one of the ways, and we were able to look at getting some mobile printers. And so not for telework going forward, but for, telecommunications in the field. And so when a social worker's in the field and they need to print off something like a case plan for a family to sign and review, they have the ability to do that, similar to what law enforcement has in their vehicles, the printers and whatnot. So that was one area we were able to plan to spend that money. Then we were also able to use it for some concrete assistance to families, which looks like car seats, some pack and plays, and some co-sleeping beds. Because we know in our county, and as, you know, in a lot of other counties, safe sleep is a big issue and something we really need to focus on. And so the pack and plays and the co-sleeping beds were something that we thought would be very helpful. And so we're able to get several of those for us to give to families when needed.
Cool.
So a lot of, and there will be more, we know there will be some more funding, you know, here and there that kind of pops up, so we'll just try to kind of keep you aware of that. At probably our next commissioners meeting, most of these funds we were not aware of before we created our budget. And so when this happens and we receive these allocations, we then have to go, you know, back in front of the commissioners to have that approved to add in to our budget, so that we can go ahead and expend those funds and it come out of those line items versus another line item. So we'll be bringing
Budget
that
amendments, yeah.
forward. So,
Got it.
any questions about any of that? It's a lot, I know it's a lot of funding stuff, but
Nope. Money's always good.
that's right, that's right.
You want to talk about the food and nutrition services too? It's on the agenda here.
That was the piece where we've already received 54,000,
Okay.
and we're hoping to get another 54
All right.
onto that. So,
Sounds good. All right, anybody got any questions? All right, we'll move along. As always, one of my favorites is always the most exciting part of our meeting. Is when we have
You're
a
much
pleasure.
too kind.
When we have the pleasure of having Chris Conley come up and talk to us about our financial report.
All right.
So, I'd like to introduce to the public, Chris Conley with
Thank
our
you, sir.
financial report this afternoon, this evening.
And before we look at that, I wanted to add a comment regarding the food and nutrition money, the 54,000 Will mentioned, just to kind of give you some perspective on that. Our administrative expenses for that program run about 48 to 50,000 a month, so that's going to cover over a month's worth of expenses in that area. And certainly, if we receive the full 108, then that's over 2 months of the county's cost covered for those services. So
Good.
our August financial report. Reimbursements for the month totaled $361,071. We ended the month with receivables at about $920,000. Expenses for the month totaled $993,910. So county dollar utilized in the month was $632,839. If you'll jump down to the highlights section, I just noted that we did not receive reimbursements totaling almost $400,000 for July expenses in the month of August. Had that money come in as scheduled, then our county dollar would only have been about $233,000. So that's why we were up. The $632,000 in county dollar is high for us, but there was an explanation for that.
All about timing, ain't it?
Yes, yes. And we seem to deal with that virtually every month. Looking at our comparison of current year to prior year through August, expenses are actually down a little over $26,000 compared to last year. Revenues are down $414,000. That's simply due to the timing on the late revenue this year. And because of that, our county dollar is up $388,000, but would actually be down $11,000 compared to last year should had the $399
Come in
been
time,
received
right.
timely. Be happy to answer any questions if you have any.
Anybody got any questions? As always, my friend, we appreciate you coming up and doing this for us. I know that it takes a lot of your time and putting this together, but it does all keep us all on track and help us understand where we are month to month. So thank you for all you do.
Thank you.
All right, next, with Child and Adult and Children's Services highlights, Ms. Kim Arnett, Children's Program Administrator.
Okay, so our child welfare data has been pretty consistent over the past few months. And adult guardianship and reporting data for APS, I think, has as well. I'll go into a little bit of highlights. There's really nothing in our statistics that I really want to point out. If you see anything there that you'd like to ask questions about that looks different to you, feel free to do that. But what I want to talk about more is some of the highlights that I've listed on your sheet there. The first one is some legislative updates that we have had over the past couple months, and I'm not going to get down in the weeds too far with these because there have been a lot. There have been some changes to definitions in the juvenile code, which changed to the definition of a relative, and that affects how we look at screening, and that also affects how we look at placement of children. There's also been a change to the neglect definition in the juvenile code, making it a little easier to read and understand is their purpose for that. Also, there's been some changes on our requirements and our due diligence to notify relatives when children come into placement. They've added this is something that we have been doing, and we had gotten the social worker 2 position for placement coordinator, who also takes on the task of notifying relatives when we bring a child into custody. In addition to what we are already doing or what we were already required to do, now we have to make those efforts known to the court. And so that's another requirement that we, as part of these changes. Also, relatives now have placement priority over non-relatives. That's something that our agency has done already. And so, when we have a child that comes into custody, we're in the process of looking for relatives, and so we are very clear with our foster parents that if we do have a relative that is able and approved to have placement, we may have to move these children. And so we're pretty upfront about that, and now that's written into the juvenile code and these legislative changes. Also, there's an increased preference for siblings to be placed together. Again, something we've already been doing, but now having to demonstrate what efforts we're making to make that happen, we're having to demonstrate those efforts to the court. Some things that I'll just mention that I'm not going to go into a lot of detail about are titles of hearings have changed, really just making it a little more difficult for us because we've had to change all of our court report templates, and so that was very frustrating for our attorneys to have to go back through that. And then also our social workers who have to now have different templates to use, and so they're having to redo all of their court reports. So it's a lot of work. Some of these changes I think are positive changes. Others, we were already doing. So I'm happy about that. One of the other big changes was we have what's called Ryland's Law. I won't go into great detail about that, but it's a time frame to do supervised visits with parents and children. If you're recommending placement to go with parents, you have to have a certain length of a visit in the home, supervised, and 7 days apart. You have to have at least 2 of them. Now we have to do that even if we're going to recommend unsupervised visitation for parents. And so just a little bit of an extra step there. Also, there's a new provision that a positive drug screen for a parent cannot alone be used to deny that parent visits with children. And that's something that our agency does anyway, because I'll be honest, with substance use, it is an addiction. And as long as that parent is coming into a visit sober, and they're not endangering that child or not putting that child at risk, it is better for that child to be able to see that parent. And so we try not to stop visits because they're testing positive and not under the influence during a visit. Now, if they are under the influence during a visit, we stop that immediately, and we have to end the visit.
How do we test them prior to the visit?
We don't test. It's more on behavioral. So it's pretty clear most of the time when someone is under the influence, and so if, we test periodically, but not before the
Right, I got
visit. So it's pretty clear, though, when we identify someone under the influence, and we'll stop that visit. There's some other minor changes that I don't know that we need to go into detail about, but just know there was quite a few. The 18 to 21, there was some changes there about what we need to make sure we offer to those youth at age 17 as they begin to transition into adulthood, and so some things that we have to make sure we provide, and then, of course, demonstrate that to the court. So those were a lot of changes we had to come together on, and our attorneys worked really hard to put together a summary for all of our staff and our supervisors. They do a very good job at interpreting those changes and then communicating that to all of us. We rely on them heavily for that, of course. Another thing on the highlights is our Caldwell County School Panel. So in August, I was invited along with DJJ and VIA to sit with the counselors and social workers to have somewhat of an informational panel to talk about just questions that they had about how we communicate and work together. And it was I thought it was a very good presentation meeting where we were able to talk about a lot of things, share a lot of information. So, yeah, that happened in August. And so was glad to attend that. Thought that was helpful for us. And then the last thing I want to talk about is an intake study. So intake, you remember, is when someone calls in a report and reports child maltreatment to us. And we have to fill out a very long form and ask a lot of questions. And so the state right now is looking at how to make that process a little more effective and potentially change that form that we have to fill out. And so in October, the state's going to be doing a study across all counties and sending out vignettes of different situations, and having at least supervisors and a couple social workers in each county participate in this study to see how those questions are answered or those situations are assessed, so that they can look at whether what they have now is working or what areas do they really need to change. So we look for that sometime in October. So that's all I have for this evening. Are there any questions?
Anybody got any questions? As always, Kim, we appreciate you taking the time to come up and visit with us tonight and give us all the information.
Thank you.
Next on our agenda is Family Support Services highlights. Will Wakefield.
So you have some of the numbers there, but I just want to touch on some of those. As you see, in terms of the numbers of individuals we provide food nutrition benefits to, there's 14,770. And then the amount there, $3,395,320. That's a very high amount. It's probably the highest that we've had. We continue to have those high amounts at this point in time. Providing medical coverage through Medicaid, 24,672 individuals. If you think we have around 83,000 individuals in our county, that's a large number of individuals who are benefiting from Medicaid. I did want to mention that our energy services preparation, starting for emergency assistance as we begin to move into kind of the later fall part, get in closer to winter part of this year. That's when we really begin to think about our cold weather services. And typically that's when we have the most people coming in, is kind of that December, January, February timeframe. Last year, the state really worked on the ability for people to go online. So people can go online and apply for those services. They can call our agency. We can do applications over the phone. We can do mail-in applications, those types of things. And so we really look for this year to be similar, to be done in a similar fashion, so that, individuals don't have to come into the agency if they don't need to. And that actually worked very well last year. We had really many people who were able to take care of that without having to come into the agency. And we talked to them on the phone. We sent information back and forth, and that that really worked well. So we're beginning that prep work to get ready for that part of the year, because it's just those 3 months or so, it's a busy time of year. And for the economic services staff who serve those individuals, that's not something that we do in the other months of the year. And so they really do have to kind of take on a good bit of extra work during that time frame, which obviously also covers the holiday season, which, can just make it a little bit more, that much more hectic when you're, dealing with those types of services. So any questions you may have about any of our economic services, I'll be happy to answer it. I will say, just to tag on to kind of what Kim was saying a while ago, I've mentioned in the past couple of months that our adult services area has, it's just really picked up, and just, since, I don't know, February, March, has really been hopping, and that has continued. We've had some cases and some situations where some individuals really needed some assistance, and we needed to get them into placement. And finding placement is not a simple process. It's not a quick process. We cannot make a facility take someone into placement. We have to ask, and we have to send in information and medical information, all of those types of things. And, that's not an easy process. And so there's been several situations where we were able to use some of our funding to help basically care for those individuals in their home until we could find a placement that was appropriate. We don't like to do that. We would rather get them moved into that placement as soon as possible, because the reason we're saying they need to be in that placement is they need some level of protection and care that they're not getting in their home. But sometimes, we don't have that choice. And so, our adult services staff have really, really done a good job assisting some of these individuals and families, and just trying to find different ways to deal with some of these situations that have been very, very challenging.
Is that a problem? Is that something you run into a lot, where you say, hey, we've got this person and here are their needs, and the home says,
It can be. Usually we find a placement. It's a matter of it happening as quickly as we would like. That's
Yeah.
typically the issue. Maybe we find a placement in a couple of days. Maybe it can take a week. And sometimes it depends on the issues that the individual is having. If it's someone who requires a lot of nursing level of care, a nursing facility may be set up to care for the individual. But right now, as you know, there are shortages in hospitals, nursing facilities, assisted living facilities. And so some of those facilities, they say, they've told us, well, normally we could take them, we have space, but we're having a shortage in terms of people.
Staffing issue.
Yeah, staffing
Yeah.
shortage, and so we've run into that.
They have the
so-
beds, but they ain't got the bed staffed. Yeah.
Exactly, and so, it has been challenging, over the past several months.
All right. Anybody else got any questions? Well, I rudely forgot about this, and forgive me for not saying this when we started, but I want to thank you guys. I've always heard that you don't want to miss a meeting, because if you miss a meeting, then you get voted to do things.
There you
People appoint you to stuff, but no, it was an extreme honor to be appointed back or voted on to be the chairman of this board for another few years, and I want to thank each one of you, and thank you for your willingness to serve, and thank you guys for all you do. It's I know sometimes we come in here and we hear all this stuff, and we're not real sure whether we're making a difference or we're doing anything or not, but I assure you we are. I think that I'm very proud of the board we have today. I think you guys are doing a wonderful job, because we're all engaged, we all understand what's going on, and so it makes a big difference than just coming up here and listening and going home and forgetting about it. So I know we all have a servant's heart, and that's what it means. It means a lot. So thank you again for the honor to chair this board.
well, thank you for accepting it.
Right.
Yeah, absolutely. Well, I guess I did. Yeah. So with that being said, if anybody else got anything?
I'm sorry,
Go
I was
ahead.
going to mention one
No,
more
go ahead.
thing. I neglected last month. I mentioned that you would be receiving, would be doing my evaluation, and I talked with Donnie last week, and we were working out a better way, I think a more efficient way to do that, and so I have not sent that to you. You will be receiving an email from Lori that will have my evaluation form on there. That will go directly to you. You can complete that. You can send it back in by email. You can send it back in by mail back to Lori. I will not see that evaluation. Lori will take that information. She will put that together, and then she'll get that to Donnie. And then Donnie and I will meet and discuss
Go over it.
that.
Yep.
So we will be getting that out to you. I neglected to get that out to you last week, and so Lori will be getting that out to you, should be by the end of this week. So,
Sounds good.
Thank you.
All right. Well, with that being said, our next board meeting will be on Tuesday, October 26th at 5 p.m. here in the same location. And with that, I will entertain a motion to adjourn.
I move that we adjourn.
I'll second.
All right, we have a motion and a second. All in favor, please say aye. Aye. All opposed? No. Motion is adjourned. Thank you for joining us this evening.